and welcome to Round Robin. I'm Robin McCormick with the City of Hampton, and today we're going to talk to those of you out there who might have a chronic disease or condition, or if you're caring for someone who does. We can make your life a little simpler, better, healthier. Let me introduce you to my guests, Kim Weitzenhofer from Riverside and Megan Dewitt from the Hampton Health Department. Welcome.
Thank you.
You know, I think sometimes people who have a chronic condition deal with it when they have to. So you go along and then all of a sudden something happens, you run to your doctor or to the emergency room, you get over the crisis, and then you kind of ignore it if you can. But what you're finding is there's models that show you're healthier and it costs less if you manage your condition in a different way.
Absolutely.
How do you do that?
We'll introduce the Stanford University model of chronic and diabetes self-management. So we have 6-week workshops.
You're going to help us. And this is one of the things, too. Is
We're going to help you help yourself.
Exactly.
Yeah, because it's scary. You know, for people who have a condition, A, you don't really want to deal with it. B, it's a lot of work. And C, is it scary? And if you can ignore it, you feel like that's better.
Right.
And I think sometimes you talk to your doctor and they say, go do this, but there's no follow-up.
Right.
So you guys have a program where you're going to teach us to do this better.
The program is actually designed to help people better manage their conditions, to help them live a healthier, fuller life. So basically, we're teaching them the tools and the skills they need to manage their own health, and prevents them from making those emergency room runs and visiting the doctor when they just have a flare-up.
So it's going to save them money. It's going to save the health system money because we all pay in, and costs are spread in any kind of insurance kind of grouping, and it's going to help their lives, right? You don't have those peaks, or at least not as often. You have a better quality of life.
And it's not just the individual, it's also their caregivers or their family members. They can also attend these programs, so it's for both of them. So now you've got the individual who has the condition taking control of it, but then their family members also learn to better understand what that individual is going through and how they can help them better manage it.
And support, because you know what, it's very hard to make lifestyle changes by yourself.
It is.
And if your caregiver or partner or parent or whoever that person is who's with you day to day reinforces it, it's got to be a little better.
Definitely.
So what is this new program?
Well, it's not new. Stanford created this in 1996. It's evidence-based and proven to improve quality of life and decrease all the symptoms, the symptom management that you just touched on. And we're providing tools once a week for 6 weeks in 2.5 hours, very interactive, participative setting. So we learn from each other. Even though we have chronic conditions or are caregivers, we can still help each other. There are 2 trained leaders, co-facilitators, who are lay folks, not necessarily clinicians. And we're providing the tools of Stanford, such as action planning, decision making, problem solving, and then of course healthy eating, especially in the diabetes self-management workshop, really diving into how to create breakfast, lunch, dinner, meal plans, and reading food labels, and then exercise. So the tools and action planning is every week. And problem solving. We're helping ourselves break these big monumental things down, and not necessarily what the doctor wants us to focus on this week, but what do I want to do? I want to get to my grandson's graduation, so what do I need to do to get to that? What do I need to do this week? And breaking it down, making it measurable and successful, so raising our confidence.
So, I mean, and you say this isn't new, but it's a little bit new here. And you guys have a grant, and you've got a ton of partners. This is not, the health department going out there and doing something, or hospital going out there and doing something. This is really a cooperative effort. How does it work?
For 2 years, we've started the CARE Coalition on the peninsula. So from Gloucester, Greater Williamsburg, York County, Hampton, Newport News, we are collaborating. So we bring together our strengths with Hampton Health Department, Peninsula Health District, Peninsula Agency on Aging, York County Community Services, Riverside Health System, Weitzenhofer Health System, YMCA, Commonwealth. So these partners, we meet monthly and we to integrate and implement this into our communities. Where the workshops.
Yeah, and we try to get as many workshops going in as many different community settings as possible. So whether it's a church or the health department or at the hospital, we try and find locations where it's convenient for the community members to get to. The workshops are completely free, which is fantastic. So
it really removes a barrier. Sometimes even if you can afford it, you don't want to pay for it. Yeah, so it's free.
It's
You
free.
can come, right?
Yeah, absolutely.
What kinds of chronic conditions are you talking about? Name some of them.
So
I think diabetes is going to come to mind.
Absolutely.
Because there's so much savings and quality of life there if you change or manage it in lifestyles ways.
And that's why there's actually a diabetes self-management program specifically for diabetics. So as Kim mentioned earlier, we really delve into how to eat properly, how to watch your carbohydrates, exercise. So we have that piece.
And this is mostly, I assume, the type 2 diabetics. I mean, you can help manage what they call type 1 or juvenile in a different way. I mean,
And pre-diabetics.
And pre-diabetics,
Fantastic.
absolutely.
And a lot of us are. I mean, this is one of the exploding health conditions.
Robin, I'm pre-diabetic. That's how I got into this.
Really?
And I thought, I exercise, I eat right, but so this is a great tool.
Right.
Because I don't want to get
You
to
don't
the
want it,
insulin.
right? You can actually prevent it, or
Right.
at least delay it.
Right.
Right.
Okay.
And just to go back briefly and touch back on the chronic conditions, because a lot of people that we're finding, they just don't really understand what that means. But chronic conditions are slow to develop. They worsen over time, usually for life. So things like diabetes, heart disease, high blood pressure, asthma, chronic back pain, I mean, the list just goes on and on and on. But those are your chronic conditions. And what is taught in the Stanford model is just life skills to manage all of those to give you a better quality of life overall.
You know, as Americans, we're used to our fast food. We live a
Yes.
very high-paced life. It's easy to come up with excuses why I didn't walk a mile the dog this morning because it was raining and I stayed in bed instead. You know, all of those things. So, I mean, it's got to be hard to motivate us to take charge and to, you know, change things and live in a healthier way.
It definitely is. And just to kind of touch briefly on, again, what Kim said, the action planning portion of this is probably the most beneficial piece to this program because it allows people to focus on something that they want to do, but it teaches them to break steps down into baby steps. So they're not tackling, oh my gosh, I have diabetes. It's, okay, maybe I can change one thing about the way I eat to help manage my blood sugars. Maybe instead of drinking soda, I'm just going to drink water. So it allows them to take baby steps to improve their overall health.
I think that's important because when people get scared, sometimes they see the giant big picture and it's overwhelming. Because I know, you know, I need to make 1 million lifestyle changes, but I can't handle 1 million lifestyle changes. So you guys really work with them and support them in sort of one at a time.
Right.
Absolutely.
We'll brainstorm as a group and problem solve techniques to communicate better with each other, with their partners, with their healthcare providers, and reduce stress, get a better night's sleep. So it's not a group of 16 people with all the same condition, but we all have similar symptoms. And we're really looking at those tools and lifestyle tools to better manage those symptoms.
Well, you know, all of the ones you mentioned, at least initially, have a component of weight and exercise.
Absolutely.
I mean, even back pain, if you're carrying too much weight or if you're not strengthening your core muscles, you know, I know that's one of the causes of mine. And so there's this commonality, I think.
Right.
And we do provide this living a healthy lifestyle, living a healthy life with chronic conditions book to everyone, and this is part of the grant that is provided. So it's a free 6-week workshop, free book, which has a lot of those exercises you were just talking about. So it's a good resource reference guide.
Yes.
They have homework each week. They don't have to turn it in, but it just reinforces what they learned that week.
So how are you reaching out to people, besides coming right here on TV and talking to you? How are you letting people know about this? Like, how do we get people to go and do it?
We can come talk to, if you have a host site in mind, your church, we can talk to members there and let them know. And we're actually hosting it coming up in September.
At Zion Baptist Church right here in Hampton. So September 21st, I believe, is when that workshop starts, and it's a diabetes self-management workshop.
Okay, so sometimes they'll have a theme where everybody will have the same chronic condition, and other times they won't necessarily.
It's chronic condition self-management or specifically diabetes self-management.
Well, that one's so big. I mean,
It
really
is.
and truly, and when you look at the numbers of people and the cost and the
Right.
quality of life for something that we can manage ourselves to some extent at least.
Definitely.
Definitely. But you can
people-
find how to register would be online at excellenceinaaging.org/CDSMP, or the phone number that you'll put on the screen, hopefully. But the phone number for just any workshop to call and say what's coming up in my area is 757-594-7313, and I'll leave this with you.
I think, to some extent, when you hear about the wide variety of organizations that are coming together, and no offense, both of the local hospital groups, you have to realize that this isn't about money. It's about community health. And, Megan, that's kind of your job.
That is my job, and it's so important. It's a great program, and, we have participants who come back and tell us about lifestyle changes they've made or that they've lowered their A1C through doing this, and it's great to see that in our community.
And Kim, you mentioned asthma, and I think in Hampton Roads we have a higher incidence of asthma than most places in the country. That is one where it does require a lot of self-management and at least monitoring.
Right.
You work
And
with
you can do it.
people, in that, and especially juveniles. That's where, the partner comes in too. When you have a child, they need a
That
little.
caregiver.
Yeah. Okay, so let's recap. Diabetes, heart disease, another still growing. We've known about this one for a while. We know what to do.
Right.
Maybe a little less fast food, a little more walking, but just making those changes and talking about it, not
Yes.
ignoring it.
That's a great
That's got to
point.
be a key
Yes.
point. You got to be.
Sometimes life gets in the way. We can action plan to bike outside and get a little exercise, and then it rains. What do? So you
Yeah.
come back to the group, and maybe the group helps brainstorm. Well, there's a walking group at Patrick Henry Mall, or the
Right, the
maybe
Boo
try
Williams
this.
Sportsplex. Or,
Yeah.
one of the things I love is that our community centers in Hampton are really cheap. It's a $25 membership fee for a year, and you can go shoot hoops, exercise, walk. You pay extra for classes,
Right.
it's sort of a pay-as-you-go model, but you only pay for what you use. You don't commit for the long term, and I think that's a great component to getting people started as well.
Definitely.
So, yeah,
YMCA.
Yeah, the YMCA is great.
YMCA, even as a partner, has provided free 6 weeks of use of the facilities for
And that's so good for working
participants.
parents too, because they've got childcare, they've got,
They do.
I used to do water aerobics when my kids were taking swim lessons, you use your time,
Yes.
whatever you have, to try, like you said, to be flexible. This week where it's rained every day, you have to do something else.
Right.
So register for a class,
All
come
right.
to 6 weeks to the YMCA and get the free
Free
tools,
book.
free book, make new friends. It's a win-win.
Now, does it require a diagnosis, or do you walk in and say, okay, I know I'm overweight, my dad had heart disease, my grandparents had heart disease, I know I'm high risk even though I'm not there yet?
We just need your first name, last initial, and phone number.
Okay.
Yeah, it doesn't take a physician referral. This is self-management.
Great. I'm excited about this. This
So
sounds
are
like
we.
I'm in. All right. And Kim, you already gave us the phone numbers to call for more information. We've got the website out there.
Yes.
And if people forget, they can call the health department.
Absolutely.
You guys can refer them.
Definitely.
You're always a good resource for community health. Thank you for coming.
Thank you
Thank
for
you for-
having us.
Geez, you're inspirational. So, you have no excuses. You can make lifestyle changes, and they will help you break it down and work with your own goals, not just what your doctor tells you to do, but what you think you can manage, and be a partner in having a longer, better life. Good luck.